Welcome everyone to Acadicus Simulation Pulse Live. This is going to be episode 51, and I have Rick Castille, our customer experience specialist, is with us today, Bill Ballo from Madison College, and Mitch Luker from NWTC up in Green Bay. And I just wanted to first remind everyone that all past episodes are available on our website. So if you go to I'm just going to share my screen quick. If you go to acadicus.com/pulse, you can see all of the past episodes. So there's a lot of great resources, a lot of interviews with customers, content showcasing, going over some of the features of Acadicus. So if you're interested in virtual simulation and you're just trying to learn the basics of it, this is a lot of resources here for you to come and check out. So last week, we talked about the 3D recording feature of Acadicus. And this week, we're going to talk about the Simulation Manager. It's a tool that allows you to facilitate simulations, to manipulate variables in real time. And we can load up Acadicus and go through that. And if anybody has any questions or wants to take things in a different direction, we can do whatever we want today. So no rules. All right. Well, I guess I'll just pull up my screen and we can just get started with that, unless you guys have anything else. No.
Sounds good.
Jump in.
Let's do it.
And John, I think there's some videos of me going through the different portions of the Simulation Manager as well. I don't know if those are posted up on the website or not. And it's just kind of a like, what does each of these things do sort of thing?
Yeah, I believe there are. They're in
Okay.
I think on the YouTube, in our YouTube channel, I think there's a tutorials playlist, and I believe those are on that
Awesome.
playlist, but we'll have to verify that. So I'm entering into a private lab here, my little demo lab, and here's Vincent. Vincent, our respiratory therapy patient, happens to be in here. So yeah, I guess just I'll talk about the basic functionality of how you open it up, but I'd be interested in hearing your perspective as users of Acadicus with students, how you use the simulation manager and, how it can be used to help facilitate simulations. But, in non-VR mode that I'm in right now, I can just hover down here, open up my menu, and then I see the simulation manager and I can pop that open. And then all of the different assets that have any controls will be available on the left side. And you can select that. And then we see the green highlight around the patient initially to see that that's the patient, that's the asset that we have selected. And then we have all these tabs here. And this happens to be one of our Gen 2 patients. So this one has a lot of different capabilities that we can go into in terms of circulatory, respiratory, digestion, abdomen, all different kinds of things here.
John, it sounds like somebody left his oxygen on.
Oh, did they? Okay,
Yeah.
Let's turn that down. There, that's better.
Oh, man, I hate it when they do that, leave the oxygen on and running like that. That is such a waste.
Yeah.
It's funny you say that, though. That's an actual issue, Bill, because in our sim lab, like, we have to make sure and unplug our oxygen from the walls, because even just leaving the regulator in depletes our oxygen supply. And because we actually have true oxygen in ours, it's not just air. Like, then that's a cost. And so even in our skills labs and stuff, so that is a real issue when you have at least in Acadicus, it doesn't cost you any more money.
Yeah.
That's right. Very true. We'll load up another one of these simulations here. See if I can find one that has some other additional features that we can talk about as well. So in terms of facilitating a simulation or even setting up for a simulation, what are some of the things you might do with the simulation manager in order to prepare a patient for a given case? Obviously here we're in one of the OpenRN scenarios, and we can see that there is a history and physical here. We've got, it looks like, set up for EKG and some respiratory stuff, but what might we change on a patient, I guess, depending on the case that we're going to run today?
Hey, John, one of the things I'd mentioned, and I'm glad you selected this one, is that on the panel to the left under assets, a neat little addition that Sean added several releases ago is that little padlock. And I found this very helpful. When you get multiple assets that can be controlled by the sim manager, oftentimes there's only 1, 2, or 3 maybe you're actually looking to manipulate or control. And by clicking on that little padlock and making it green, it pops those ones to the front that you're most likely to have to manipulate.
That's
So
a really good
that's
point.
actually really handy.
Yeah, especially as we get into the forebay, when you've got multiple patients that you're going to be addressing, you know, when you open up that side panel, there's just a scrolling list of assets. So to be able to pick just the patients or the things that you're going to be changing in real time, that's super helpful, I can imagine.
Yep.
So in this case, we can set the clock time here if we want. We can change the risk guard to have different allergies, DNR, fall risk. We can change the color of the wristband. We can change, there's an image displayer. So this history and physical is actually an image displayer slideshow asset. So we can actually change this. Any individual user of Acadicus that has a lab can come in here and change these images to have the record reflect whatever case you're running. So that's all totally customizable. And then we have the wristband that's configurable with Millie's name on it. We can actually change the name on the wristband. We can change the family name, the date of birth, the auto set year based on date of birth. That's one thing we ran into is you can only, you know, obviously time keeps passing. So if we have a set date, it doesn't always make sense in terms of the age of the patient. So we can actually change the age of the patient here and have the age auto set that way. So that's pretty cool as well.
One important thing to know about that, the band, you can't change the patient name in VR. You have to be in non-VR.
Ah, yep, that's a good point.
If you are applying that band onto the patient for the simulation, which I highly recommend because it's really nice to have the correct name, date of birth, all the things that your students would actually be checking for. But once you apply it, and then you need to exit out of VR mode, come back in non-VR mode, and then you can edit the name and date of birth and stuff then, but you can't do that in VR mode.
That makes sense. Yep. Yeah, I appreciate you bringing that up. That's a good point. It makes it a little easier too, because you can use your keyboard then to type out the name instead of like using your VR controllers to like click, 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 try to find the keys. So
yeah, but there, the keyboard doesn't come up when you try to do the edit in VR. And so you have to, and I kept being like, where's my keyboard? And then I was like, oh, I need to go out of VR to make that happen. And so just for FYI for people, if they're starting off and they're trying to use that and they can't figure out how to change it when they apply it, just pop out and fix that.
Typing in VR is not a pleasant experience.
No, not at all.
And I've not seen this, but I've been dying to have somebody actually put a name band on the patient that doesn't match the chart material, because that's so ingrained in us as nurses to make sure, right, that we're doing those checks. And I just haven't seen anybody kind of want to throw that curve, I guess, at their students yet in VR.
And actually a good scenario for that one would be from the OpenRN one. If you wanted to apply that band to the hazard ID one, because then like not only do they need to click around for all the other stuff, but could it be the wrong patient in that
patient
room?
Yep.
Just kind of going through all the functionality here, the lung sounds. You can change all these to be coarse crackles, fine crackles, wheezing, diminished, absent.
And I know there are some people that had some confusion, like, do I have to be in VR to control this? And I am almost never in VR. The times that I go into VR when I'm doing simulations, or operating simulations, the only time I really do that is if there are things that are invisible that I need to make visible. So, for example, if they're going to order an ECG, well, I don't want the ECG to be in there until they ask for it. So once they ask for it, then the ECG comes in. So then I make it visible. Or if I'm acting as, like with one of our pediatric patients, I act as the dad who brought the kid into the ER. And so that's sort of, then I do that. But that's really it. Otherwise, I'm here on my dual screen computer, and you don't even really need the dual screen. I just have it over here. But no, I'm not in VR usually when I'm operating these.
Me either. I very rarely, the only time I'm in VR during a simulation is playing a part, a character for someone. Um, because now that I've learned about using the 3D recording feature to make things appear and disappear, now I use that as my setup for those issues. So yeah, I literally, unless I'm playing a role, I'm always running things in non-VR mode because the way my lab is set up with having the screens on the walls, I can see better what everyone's doing. Because in VR, you have such a limited field of view when you have 2 or 3 students in doing something. So I can see easier what everyone's doing because they could be spread out all over the room.
Mitch, you
point.
probably have an interesting story about using the sim manager here. In your example about where you set Millie up in um, with multiple diagnostic issues for your students. And that was all using the sim manager and giving her different discrete issues that each of them had to find with the different character model, correct?
Yep. So I just use Millie and I have what's called I call it my generic med surge room. And so in that space, it's a really basic room. There's not a lot of stuff in there. And then what we do is I just go in, and so the students are asked to research COPD, CHF, stroke. I have to look at my list now because I can't remember them all. Asthma. Because I have 2 cardiac, 2 respiratory, and 2 neurological issues. And so they have to research those, and they come in, and then I say, okay, we're going to take 2 of you and we're going to put you in the scenario. And I, through the simulation manager on Millie, I will go through and just make the changes. So like if it's the COPD patient, I give her diminished lung sounds in the bases. I make her cyanotic. I just go through and click a few things. Their job is to assess the patient and determine what the medical problem is. And then we use that as a jumping off point to say, okay, so instead of relying on your physician orders and trying to get more proactive about your thinking for patient care, what would be the orders you would expect your physician to give you for this? What would be the care planning what would be the interventions as a nurse you would be expecting to put in place for this patient with the assessment findings? Because I'm trying to push them to think about assessment as the driver of their care and not their orders and not their medical diagnosis. Because when we do this, they're told that the patient was admitted because of a knee replacement. And so then as they come in and do their assessment and they're like, oh, wait, now I'm hearing crackles in the lungs. I'm like, oh, okay. So, and she's got edema in her legs now. And so I make her have CHF. And so that way, then they're thinking more about like, oh, not just the admitting problem and not just what my orders say, because their orders are for a knee replacement patient. And there's no orders for all these other issues that can arise for their patient. And so being able to give them that and then say, okay, now if this was what you found, what would you be thinking about? What would you be asking your physician for? So, and I just use the same exact room with I don't add anything, take anything away. I just make the changes to Millie in the simulation manager.
It's a great use case. Yep. In this case, we can see I have the vitals monitor selected, and we can individually control the visibility of each of these things. So if we want to turn on the waveform for the heart rate, SpO2, we can go ahead and turn those things on, all of them on, or some of them on, or whatever is connected that you want to have displayed here. I'll just go ahead and turn them all on. And then those values are then...
Oh, sorry.
Go ahead. Go ahead. I was just going to say these values then could be changed right over here in the actual patient. So we can change the heart rate and all that.
Yeah, and what's nice about being able to override like that is, you know, if you have a student who's really stumbling, you know, where's the SpO2 or whatever it may be. If they grab the SpO2 and they put it on, it's going to come up. That's just the way that works, just like it does in regular simulation. But, you know, I had one time where I had accidentally deleted the SpO2 out of there. I was like, oops. And I realized, hey, I must have deleted that. And I'm like, okay, no problem. Sorry about that. And I just overwrote it. So that just allows you to do that. Or if you're using it as, you know, more of a teaching tool or something like that, you know, and you don't want to grab everything and stick everything on, you can do that. I recommend grabbing everything and sticking everything on, but you know, something happens, you've got that override capability.
And in my sim, I will, if I'm going to have my students give, let's say, a blood pressure medicine, I can preset and slide all those values over, and then I'm ready. So as soon as they give the med, then I just hit set values and the new number comes up. So I don't have, so I try to like prepare myself. So that way, then that's one less thing I have to remember to do when I'm running the simulation, because sometimes it's easy to get a little overwhelmed yourself when the students are like, oh, and then this and da 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 da, because they get really excited, and sometimes it's hard to know, like, and it's just one less thing I have to focus on. So I can drag everything, move it around, and then wait. Because if I click over an animation or general appearance and I come back, those settings are still sitting there waiting for me to click set value.
That's a great tip, Mitch.
Mm-hmm.
That's great. Get them prepared a little bit in advance.
Anything I can prep before the time to give myself that extra advantage, I'm going to take. And so when I realized that it doesn't change it when you click onto another tab in there, that's really helpful. That I was like, oh, sweet. I can totally have that slid over and ready to go because I always come in an hour before my sim, just to make sure in case there's, you know, an Acadicus update or an update to meta or whatever system, and just to get everything up, running, set, make sure, I mean, I can get my lab up and running in 18 minutes, but I like to give myself a little cushion just to make sure that if, you know, all those little extra things that maybe I wasn't planning on come up, I've got my time and I'm ready.
That is an excellent tip. That's something everybody should think about when they're running VR simulations of any kind. Honestly, no matter what platform you're using, you really need to give yourself some time to get in, make sure everything is configured ahead of time, just like you would with any other simulation. You just need to go in and make sure all the hardware is configured and ready to go. You don't want to be working with that when the students are all waiting. So it's a good, very, very good tip. We see too many cases where people come in and expect everything to work. You know, they show up at the same time the students show up, and then they're trying to set up the VR headsets, and that just doesn't give you enough time to run a smooth simulation at that point.
Yeah, absolutely. My norm is probably an hour before. I definitely never need that much time, not anymore. In the early days, yeah, I absolutely needed that time. And then when I do sort of my traveling show with my laptops, then I usually need more time. But it's not because of Acadicus. That's because I'm setting up a boundary and I'm doing, you know, all of that sort of fun stuff that goes along with the computers itself. So
Absolutely. Just to give you an idea of a completely different patient with a completely different simulation manager, this was a neonatal simulation for McAdams Research Group at UW School of Medicine at Madison, and they've got a patient here that has very focused functionality. This was before we had Gen 2 patients, so there's just lung sounds, presets for troubled breathing, or if they're intubated, if they go through the intubation steps, we can have troubled or normal breathing here. Vital signs are pretty simple. We do actually have to connect these devices to the patient in order to get some of those readings there. So we can put the stickers on, get that going, get the leads on, and then that will generally appear up here, and we can power on or off the warmer. We can change the oxygen, PIP and PEEP can be changed, and all of that. But this is a very different kind of functionality than we have in the other patients. So, and also in this case, we have a nurse here, very simple functionality, mask on, mask off. I think she originally did not have a mask on, and then during the pandemic, everybody was driven to distraction by the fact that she didn't have a mask on. So I think we built in that functionality to be able to turn that on. And then of course we have family members, and we've talked about this in the past when we've had Dr. McAdams and Dr. Trin as guests, where to them it was just as important to be able to teach communication skills and to be able to communicate with the family after a neonatal intensive intervention. You have to come over and talk to the family and explain what happened, which is a really important part, and it's really difficult to teach that, and it's very difficult to get that experience, even in a real world setting. You don't often have that experience, so this gives them an opportunity to practice those communication skills. Another thing you can do in the simulation manager is change the ambient audio. And this was one of the things, even in this simulation, I remember we built this simulation. We were all proud of how realistic we had made it and how accurate it was to the real scenario. But when the physicians actually tried it out, they were like, something's missing. And it was the audio, and they were like, during a resuscitation, it's much more, there's a lot going on from an audio perspective. And so we turned that, we had to create the audio and create a lot of different background sounds, so makes it sound a lot more realistic. And I know it sounds kind of strange to say, but audio, really high quality audio, actually makes things look more realistic. Like if you're in a scene and you're hearing realistic sounds, you're much more likely to become, or I guess, suspend disbelief and actually become immersed in the scenario.
Well, and I like it because then you're mimicking more what students are going to face in a clinical setting. Because, in a clinical setting, when you're trying to quiz meds with them and you're doing all the stuff you're going to be doing as an educator, excuse me, they're going to have to deal with noise and distractions as they're trying to, tell you the mechanism of action for the medication that they're about to give. And so I really like it and my students sometimes will hate it. They tell me that they don't like it. And I'm like, but you need this because this is what's going to make it like what it's going to be like when you hear the call light going off at the hospital while we're trying to do clinical.
Absolutely. Another thing I wanted to point out is when I'm loading these up, anybody that has a lab in Acadicus, if you open up your menu and you go to your simulations button, you can go to your shared library. Every lab has access to this full shared library. So you can immediately, day one, have access to all these simulations, and you can use them as they are, or you can go in and customize the simulations however you see fit. So we do have the scene editing tools, which maybe we'll talk about next week. Friday, we'll talk about scene editing since we're going through the basic functionality here. But and I'm realizing I can't actually hear the scene audio on my end, so it's probably louder.
We're hearing it.
Than it is from me. So if it's too loud, let me know and I'll turn it down. But this is another case where the simulation manager can get pretty out of hand in terms of the number of things that you can change in a scene. We've got this is our multiple casualty scenario. This is one that Bill designed and I helped kind of implement a couple months ago at this point. And just recently, Jamie Howell from Western Technical College took this scene and made a couple of edits to it and actually hid some of the patients. So they're actually kind of hard to find. You have to really look around to find them, and changed some of the variables and made it her own and kind of made her own modified version of it, added another crashed vehicle, and kind of changed the narrative of what's going on in the scene. But here, in this case, the simulation manager has all these triage panels. So we can actually go in here and we can select these different panels. So if you go up, I'm going to close my menu for a second, but the way this scenario works is, and Bill can probably speak to this better than I can, of course, but we have start or salt triage panels, and the student can come up and they can go through a very basic patient condition kind of analysis. They can go through each of the different things, whether there's radial pulse, repositioning airway, checking respiration, and then they assign them to a group. And again, salt and start have slightly different ways that you assign that, but you can go ahead and select that. I'm going to guess minor on him. Good. Got it.
Nice job, John.
I learn a few things from hanging out with you. So yeah, but I guess my point was that you can actually go in the simulation manager and you can change. I'm not actually sure which one. There it is. So we can actually change that. If I wanted him to say, let's say he's delayed is actually the right answer, and we want to change his pulse, or we want to change his respiratory rate, we can change those values and then save the simulation. And now if I were to go through this again this time and say that it's a minor and hit submit, that's incorrect because I just changed it on the fly. So again, we can go through and we can reconfigure every one of these patients to be a completely different scenario. We could have this guy laying down. We could have, any number of different things changed on any of these patients, and then save that scene, and then it'll be available next time we come in.
And when you're in VR, I like to edit these in VR because it's a lot easier to find the one.
Yes.
John's kind of hunting through there, but it's a lot easier when you're in VR. You just hit it, you just click it, and then you're there. So it's a lot easier then. But sort of the key here is if anyone has done mass casualty before, they used the gingerbread men, right? There's these little gingerbread men. It comes in a big bag, and you've got triage tags, and then you've got these little gingerbread men that you lay all over the place, and the students have to go around.
Did Bill's audio cut out for anybody else?
Anybody else
just going to
Bill?
Yeah,
we
sorry,
lost
Bill,
your audio.
We can't hear you.
That's because my mute button got hit.
Oh, there you go. Gingerbread.
So the gingerbread men, right? So, and then you go around and you look at it. It's got all the information on it, and you put a triage tag or a color. Or I had an instructor once who had a whole big bin of stuffed animals, and laid the stuffed animals out everywhere. And with the stuffed animals near them had pictures of injuries, and like a broken leg or something like that. And really cool, really innovative. Don't get me wrong, that's pretty awesome. But that's sort of where this stems from, is that ability to then go and do triage. Now you need to go in there and do triage. The other thing is that we used to do a really monstrous mass casualty incident here at the college. We'd have the fire department join, we'd have police, we'd have nursing, we'd have everybody. All of these places would join, and it was extremely expensive, especially just to get the people to do it, the actors, the employees, and then the students came in and they all got to go through it. And you'd have maybe 10 students who were acting as the medics and stuff like that, or maybe a little more. But that was it. Then you did it and it's over, and that's it. And you clean everything up, and that's all there was to it. The reason that this was such a big thing is that you could just hit reload, and you can reload the scene. You can make any changes that you want to the patients. You can have them, they're not Gen 2 patients, so they're not going to have major things, but you can add Gen 2 patients. And I think that's what Jamie did. You just grab a Gen 2 patient, stick a Gen 2 patient in there, and then you want more things that you can do to that patient and more things that you can control. You've got it.
Yeah, and I think in her case, she actually added some of the paramedic bags and some of the equipment next to those Gen 2 patients. So students are actually doing some of the intervention and not just assigning them to a group, but actually going through some of the assessment and, working with some of that equipment.
Yep. I am going to have to cut out a little early here because I think the basketball team's showing up a little early. So,
okay.
So good to see everybody. I'll see you on the next one.
Yeah. Thanks, Bill.
Yep. Absolutely. Take care.
I think we pretty well covered the simulation manager there. I'm not sure if there's any other functionality that is in there that we didn't go over, but I think, yeah.
There's one thing that, so when you were doing Millie earlier and she had that vital monitor above her, but there's now the new vital monitor that has different heart rhythms in it.
Oh,
and
that's
that
right.
one you control through, so the vitals don't change off of the vitals of Millie under her sim manager. You actually have to make sure and click into the vital monitor one and change the vitals in it, because when you put that one in, and you have the different rhythms, and actually if you want to go into my lab, John, and go into it's Ricky Lecture 1 or NWTC Ricky Lecture 1, to show that monitor, just because I like that monitor a lot, because when you're talking about the more advanced level students, you then get to see, you can have that, VFib, VTAT, like you get those more advanced rhythms. And I think that that's a really cool feature. And for people to be able to see that you can affect.
Oh, maybe I'm in the wrong.
Nope, you're in the right spot. Just keep going. It's NWTC Ricky Lecture.
Oh, NWC. There it is. Oh, there it is. Yep.
I always put NWTC on there to make sure I know where that
That's
it's one of when it's ready and produced and set, then I put the NWTC on there so I know where to find it easy.
Good call.
So then, because like I have a different rhythm on there right now. So when you go into the sim manager, and you click on there's animated vitals monitor, and then you can, and so when you're going to edit the vitals, you have to come into that, not under Vincent.
Got it. Yep.
So if you go under Vincent and you change the vitals, nothing will happen.
Yeah, that won't change it. In this case, if you're using this animated one, yeah, because then you do have the expanded functionality of the waveforms in that case. Yep. So we can have, well, we won't do asystole for poor Vincent here.
I love it when I come to these and I learn something. That's awesome.
Yeah, and so you can, and like when we're doing cardiac stuff, because like she wanted to have him in sinus tach because of his fluid overload. And so, but like if you were doing, like I think about our advanced skills course where they start learning rhythms and treatment of those rhythms. And so one of the things that I'm hoping that we get to, produce at some point is to have where, because right now we do an in-person simulation for their checkoff. And I would like it to be VR, because then they can come in, they can put the patient on the monitor, they can do all the stuff, and then we can actually even treat, the different rhythms. So if we wanted them to go into sinus tach, and okay, what medicine would you give for this? What would you do for this rhythm? And because you even have the ability for shocking, because you can do shock and then revert. So you can, yeah, and then we have the urinals are over behind you, which that's where, because this is the one we used for Ricky's nephrotic lecture. And so to show the different urinals and different types of, at this point in kidney failure, we'd have this much urine output, and in this, we would have this. And I can click in there and change whether it's clear, yellow, bloody, and the amount. So But the animated vitals monitor was, I thought, is such a amazing feature that I love. And especially the fact that you have all those different rhythms now in there to play with and to use for teaching. But I didn't realize until later that if you change Vincent's vitals, that they don't change. And I'm like, why won't this change? And then I'm like, oh, because I use that monitor. I have to go in and change it on the monitor, not Vincent.
That makes sense. Yeah.
Nice setup here.
Yeah, this looks great. You've got image displayer going on, and
yep, because I wanted her lecture in the space, and so and if people want to go back and watch the one where Ricky came and visited Pulse Live, because this is where we did her renal lecture that we showed that week. So, but that was a new feature that is really cool, and I hope people use it more, because the animated one, because you can change like the CO2 waveforms, and like you can really get some cool stuff on there.
Only have to go and play with that a little bit.
Yeah, I'm just looking to see which episode that was. I don't remember.
I want to say 47, 46,
44.
44.
Yeah, Bridging Nursing Theory and Practice at NWTC. Anybody wants to check that one out, that's available. Just briefly share my screen here so you can see. Go into episode 44 here. You've got a video, and then you can actually watch some of Ricky's lecture and actually hear her thoughts on the creation of that. And we've got highlights for every one of these episodes. I should just mention we've got highlights, and we've got the full transcript in case you want to check that out. So cool.
Very nice.
Really appreciate you joining today. Happy Friday. Have a great weekend. And we'll see you next week. We'll talk about scene editing.
See you, John. See you, Mitch.
Yep. Bye-bye.